Yeah, yeah,
Perfect.
yeah. All right, so let me go back now and
So I think as a
so we've had the fortunate benefit of being able to engage with the professional who has participated in the vaccine studies, Dr. Corey Harwell. I'm going to introduce him to you and we're going to ask him a few questions. But Dr. Harwell, why don't you explain professionally who you are and where you are and how you got involved in the vaccine study and which one was it?
I'm currently an assistant professor in the Department of Neurobiology at Harvard Medical School, where I run a basic research lab where we study the genetic regulation of the development of the brain. And the way that I actually initially found out how to get involved with the vaccine study was actually through one of the PhD students in my laboratory. Because he had actually, previous to me, had volunteered for one of the trials and told me about the website. And I should just mention that he's a young Black man who's participating in the study. So he was kind of my entryway into understanding how to actually get involved with the vaccine trials.
Great, great. So what was there? Was there some other intrinsic value other than the fact of being an African-American male, having a colleague or an associate that was participating in it? Were there any other intrinsic things that resonate with you of why you should participate or why you should participate?
Yes. So I think for me personally, I think about, we've all been impacted by this global pandemic for, what's coming up closely into a year. And, and thinking about the impacts, not just on me personally, but on my loved ones, and in particular for my parents. So, for me, I'm, relatively young, or at least I like to think so, and I'm healthy. But for, my parents, the risks to them from contracting COVID-19 and their health, to me, there has to be some kind of treatment or some other way for them to, for us to get out of this.
Got it.
So that was definitely a motivating factor.
Good. And so give us a little bit, give us the history. Tell us how long, which one, anything that you can share with us about your process and the logistics of being involved and any subsequent side effects or anything that you have experienced.
So actually, it's only been a couple weeks. So I am participating in the Johnson & Johnson phase 3 ensemble clinical trial, which is for a single shot vaccine, which is to contrast to the recent vaccines with the Pfizer and the Moderna that's coming up for emergency use approval. Both of those are going to be vaccines that require 2 shots. So actually, from a practical perspective, one reason that this trial appealed to me is that I think in thinking about trying to reach the goal of vaccinating 70% of our population in order to acquire the immunity to halt the spread of the virus, having a single shot versus requiring people to go in for a second injection, I think would go a long way to more easily and practically achieving that goal. A second consideration is that while the data from these recent mRNA viruses or vaccines from Moderna and Pfizer require this storage at extreme cold temperatures, which for us in the United States is not going to be an issue because we have the resources and the technology to store these things. We have enough freezers and so on in the cold chain for being able to transport these things. But in thinking about practical vaccine that can be used to treat the rest of the world, where those things might not be as practically accessible, we're going to need viruses that or vaccines, excuse me, that can't be or don't need to be stored at -70 or -80 degrees Celsius.
Great, great, great. So it's 2 weeks, and any thoughts on feelings, lifestyle changes, anything that are worthwhile noting?
Yeah, so I could actually just explain just going into the trial and what that looked like a little bit. So it was basically I signed up online, and I actually signed up online months ago and had only been contacted maybe less than a month ago about the recruiting for this particular trial. And uh, you uh, they send you online a bunch of documents and forms with information about the trial, about the consent forms, obviously, about the risks, and the thing that I think that they make clear is that at any point, all of this is voluntary. So there is no obligation at any point. You can leave the trial actually at any point on your own volition, and there's no penalty for that. And so after doing all of the online documentation, you go in for the day, and they will do basically what amounts to a checkup, just taking your vitals, questions about your work and your contact with people, just to kind of, I think, gauge what kind of contact you would have and risk for COVID just as you go about your everyday life. And then they draw blood, and then you will receive either the placebo or the experimental vaccine injection. And just to say, like all of the studies that have been done, this is a study that is double blind, meaning that I don't know what I'm getting, and the people actually at the clinic don't know what they're giving you. So it's essentially the flip of a coin from a computer as to whether you're getting the placebo or the experimental vaccine.
Great, great. Well, certainly, my personal thanks. One of the challenges that we have is getting African Americans, or getting folks in studies so that we can understand what the implications and what the complications might be for them. Any messaging that you would have? Obviously, it's the topic of the day, if not the week of the year, and understandably why. Any messaging that you would like to say, if you had a platform to talk to people about the vaccine, about their thoughts about it, and any messaging that you would like to deliver to a larger audience?
So I think, my view as a scientist and as a Black person in America, I understand the reluctance about the process, but I think that with that, there's also opportunities to learn more about these processes. And I think, being in science and actually being around, people who are taking part in these studies, and also some of the scientists that are actually working on some of these studies, I think provides me with a view that I know that everyone actually isn't able to see. So for me, I understand that everything that has been done, I actually have a lot of faith in the integrity of the process and the integrity of the people who are carrying out this work, because I understand that for scientists, I think most of all, the thing that you want to do the most is actually for your work to have a great positive impact on the world. And why all of these companies and all the scientists that work at these companies and all of the work from the scientists that work at the National Institutes of Health are stepping up to this opportunity to have a positive impact. And I think that a lot of times, because of the reluctance, Black people in particular are often left out of some of the considerations for these things. So not being a part of the study actually means that there's a lost opportunity to understand the benefits and potentially also the risks for Black people and some of the particular health issues that are more prevalent for people of our background. So I think that increased participation actually provides an opportunity for those companies to actually upfront obtain the data to be able to make more informed decisions about how they can actually have the broad impact for not just the citizens in the United States, but for the health of all people in the world, and all of the differences in health status that comes with the broad and diverse populations of people in the world.
Great, great. So double-blind study. You don't know whether you got the placebo or the actual vaccine. So,
right. So I don't know, but
yep.
I'll say I think you asked earlier about side effects. So so I did experience side effects. So probably about 8 to 10 hours after receiving the injection, and that evening, I started to feel, a little bit fatigued because of the way the study went. They actually provide you with a thermometer and a pulse oximeter. So you're actually kind of taking your vitals along the way. So I took my temperature and knew that I began to run a fever later into the night. And, I got chills and actually, went to bed early and woke up the next day still feeling a little bit run down, but the fever had come down. And by that afternoon, I was essentially back to normal. So the duration of the side effects that I felt were approximately 24 hours or less, actually.
Good, good. So my final question, I really appreciate this, Dr. Harwell. My final question is, post-study, your thoughts on taking the actual vaccine?
I hope that, I would definitely take it. I hope that my family does. And again, just going back to the personal motivation is that, we know the risk for this virus, and the risk is death and depending on your comorbidities and your age, that risk is even higher. So again, thinking about my parents and the health issues that they have, if there is a safe alternative for them to avoid infection and potentially death from this virus, then I want them to, feel safe and feel secure about being able to take that. And I think the first step in that is for us to have the data to determine the efficacy of these vaccines. The safety part has really been taken care of in the earlier phases of the trial. So, here we're trying to find out if the vaccine will work so that it'll be something that I can encourage, my family members to take, because I think that the alternative risk of the infection from COVID is, it's obviously much too high. And so much so that, it's why we're altering the way that we live right now.
I appreciate it. Thank you again. Thank you for participating. Thank you for sharing the words with us this evening, and all the best as you continue throughout the study. And we sincerely appreciate your sharing your experiences with us this evening. All the best.
Thank you, brother.